Hello, everyone. My name is Ben Henwood. I'm an assistant professor at the University of Southern California Suzanne Dvorak Peck School of Social Work, and I'll be introducing today's webinar on the Grand Challenge to End Homelessness. This is the third in a series of webinars about the Grand Challenges, and the challenges themselves represent a dynamic social agenda that's focused on solving this nation's toughest problems, and it's sponsored by the American Academy of Social Work and Social Welfare. Let me advance here. So the previous two webinars focused on different topics. The first was on ensuring healthy development for all youth, and the second one was on building financial capability. And there are recordings of those webinars that's available on the Grand Challenge website that we can provide at the end of today's webinar. So the Grand Challenge to End Homelessness began as a working paper that was submitted by 9 authors, most from schools of social work across the country, as well as both Philip Mangano and Mary Ellen Holmes, who are from the American Roundtable to Abolish Homelessness. And clearly the Grand Challenges are resonate, with social workers and others, because so far we've had over 2,000 downloads of this particular working paper. And today you'll hear from 4 of the authors of that original concept paper. But the Grand Challenges and the American Academy really made these more than a series of working papers and turned those working papers into a set of initiatives, and each have co-leads. The co-leads of the Grand Challenge to End Homelessness are both myself and Dr. Deborah Paget from NYU School of Social Work. And we're also fortunate to have a national coordinator who's here with us today, Brian Redline. And he's helped develop a lot of the needed infrastructure to launch this initiative, and which most recently includes our website that you can find at www.gc2eh for Grand Challenge to End Homelessness.org. And what I thought we'd do today is I'll just show you a few screenshots of the website so you get a sense of what we've been working on. So here you can see that we describe the Grand Challenge to End Homelessness as complementary to existing efforts by a lot of different groups, including the VA and the National Alliance to End Homelessness. And so today we'll talk about what some of those complementary efforts look like. You can also see on this website, if you're interested in joining our network, you can just click on the button there and you can add your information to a listserv that we have. Now, one of the things that the American Academy did this past fall was convened a policy summit that was at the George Warren Brown School of Social Work out of WashU in St. Louis. And as a product of really that meeting, the different challenges each produced a policy brief, and you can find ours on the website as well, that came out of that particular meeting. One other thing that we recently worked on with our partners from the National Center of Excellence on Homeless Services was to really look into the research that's being done by social work. And so we had a survey in which we asked all of our network members to talk about and describe the different research that they're working on. And so you can find a brief summary of our findings there. So for today's webinar, what we really want to do is describe this Grand Challenge to End Homelessness and how, obviously it meets the different components for the American Academy's idea. These are grand and compelling. They have to be really scientifically informed and have measurable impact within a decade, and that both innovation and collaboration is needed to achieve the Grand Challenge. So what we want to do is explain how the Grand Challenge developed and is developing, illustrate what some of the different schools around the country are doing, and then discuss how to move forward as a group. So far, this is our agenda for today. After the introduction today, Dr. Deborah Paget is going to talk about really how, a lot of the impetus for this Grand Challenge came out of Housing First as a new model to address homelessness. So she'll describe that. Then we'll hear from Dr. Tom Byrne about what the Veterans Administration is doing and their exemplary work on addressing veterans homelessness. And then we'll really hear about what different schools across the country are doing, made possible by the National Center for Excellence in Homeless Services by Dr. Heather Larkin. She'll describe that to us. And then Amanda Akanian will talk about what some of the different schools are doing. And then with the time remaining, we can discuss the initiative as a group. So at this point, I'm going to turn it over to Dr. Deborah Padgett.
Thank you, Ben. So I like to start talking about Housing First by posing some questions, and they're there on the slide because it illustrates in many ways the paradigm shift that has come to be known as Housing First. And I'm going to talk just a bit today about how it started and what has happened in the interim. So I start off with a question: how often in the vast landscape of health and human services do we see a small programmatic innovation become the leading approach in less than 20 years? How often do we see an evidence-based practice that addresses human rights as central to its philosophy? How often do we see an innovative social program obtain endorsements from conservative and left-leaning policymakers? And how often do we see an innovative social program that originates in the United States become widely adopted in Canada, Australia, and Europe? So my answer to that is not very often, and I hope you will agree. So in the next slide, I begin talking about Housing First, and of course, to discuss it, I will say that the long answer can be found in a book that is co-authored by myself and Ben and Sam Tsimberis, who's the founder of Housing First. The model or the approach began in New York City in 1992 in the form of an agency known as Pathways to Housing, and from there it built into the paradigm shift that we're talking about today. Before I describe Housing First, I need to, next slide, sorry, to give a bit of the backdrop to how Housing First began and what it stood in opposition to. The existing system of homeless services in the United States really crystallized after the 1980s epidemic in homelessness as what could be called a staircase or a treatment-first approach. And in this approach, a homeless person would start at the bottom, being homeless on the streets, might find his or her way into a shelter, and then through proving housing worthiness through abstinence and taking one's medication and behaving in a certain way, that person might ascend that staircase and eventually gain permanent housing. The difficulty with the staircase approach is most people fell off. They either relapsed, they were either evicted or terminated by their programs for not following abstinence and the many rules expected of them, or they left because of those very rules. So what has occurred with the staircase, and this is where Housing First came in reaction to, is the staircase approach created a huge number of people on what's called the institutional circuit. These are homeless persons with multiple problems who ended up in jails, in hospitals, and in shelters. And the result of that is not only human misery, but also a very costly proposition because these are places, these institutional stays are very expensive to the system. So in a sense, doing nothing is probably one of the most expensive ways to address homelessness. So next slide. So along comes Pathways to Housing. It's Housing First, and it actually reversed all of these priorities of proving housing worthiness and so forth by providing immediate access to permanent housing, and this would be scatter site housing. Now, this access came along with assertive community treatment and other forms of support services. It honored consumer choice, hence I mentioned earlier the human right to housing was very much foremost in the approach. And it also practiced harm reduction, which meant that individuals who were suffering through addictions or dependence on drugs or alcohol would not lose their housing. But instead, the premise of Housing First is that this platform of immediate access to housing would provide individuals with the ability to address these other problems, serious mental illness, substance abuse, poor health, and so forth. So the idea for its time was quite revolutionary. And in fact, it was met with a good deal of skepticism, particularly by individuals working in the existing homeless services system who viewed what Sam Tsimberis did with Pathways to Housing as was called reckless or doomed to fail. How could you put someone with serious mental illness immediately off the streets and into their own apartment? And I do, on the next slide, just want to point out that in my own research with different types of interventions, being a mental health services researcher and so forth. To me, Housing First was fairly unique in being a structural intervention. That is, tackling what we sometimes call our upstream problems rather than just focusing on changing people, changing their mental illness symptoms or their substance abuse, but actually providing them with what we would call a structural intervention of having a home first and then dealing with these problems later. So in the next slide, I want to point out that the response of Pathways to Housing and other researchers was to study what was going on in Housing First. And in fact, Pathways to Housing embarked in 1997 on a 4-year experimental trial to look at outcomes comparing individuals housed in Housing First versus those who are on the staircase in transitional housing or shelters. And later on, other researchers joined these efforts. And what was surprising, if you see this slide, is the consistency of findings across these studies. Individuals in Housing First showed much higher residential stability. That is, they did not return to homelessness. And those rates were rather astonishing. 78 to 90% of those people, despite all of the skepticism about their abilities, were quite capable of adjusting to life and having a home. And also the outcomes from the experiment and other research showed a reduction in service utilization and, as a consequence, cost savings in terms of fewer hospitalizations, shelters, jail stays, and so forth, all of which are more expensive on a per capita annual basis than Housing First, even with support services. We also found in the research that consumer choice was improved, that people felt better about their lives and themselves, and in fact reduced their dependence on drugs and alcohol, which was somewhat of a surprise to many people, thinking that you could go into a program that did not forbid you to use these substances and still voluntarily reduce your dependence. And in our own research, we find that this is because they feel having a home is something valuable and worthwhile and something they'd like to stay with and hang on to. So even though they practice harm reduction, in fact, individuals in Housing First use drugs and alcohol on balance less than individuals on the circuit or in transitional housing and shelters. So the success, in the next slide, I point out that the success of Housing First has led to its adoption not only by the U.S. Department of Housing and Urban Development, it is the national policy of Canada and several countries in Europe. And so the question arises, how about Housing First for other types of populations? Because it was originally developed for the chronically homeless, that is, individuals with serious mental illness and co-occurring substance abuse histories. So what we have seen in the past 10 years or so are expanding Housing First into new areas of services, including families, where you have much more complex service systems involved, schools, child welfare authorities, custody, family courts, where the needs are greater for larger units and where domestic violence may be an issue. And in particular, domestic violence has been the subject of some pilot studies with Housing First, and which the shift is away from shelters and congregate living and more toward scatter site, as Housing First promises. And then finally, Housing First has been adopted and is currently in the midst of some new research on its application to youth. And homeless youth, of course, bring their own special issues to the table. Many have aged out of foster care. Many are from LGBTQ backgrounds. These are young people who may have been sent away or evicted by their families from their homes. And so you often find a mix of not only poverty but family dysfunction, and thus the needs and the support services are different for this population. So in the next slide, I want to just point out some places where this is being done. In particular, Minneapolis, Minnesota has pioneered Housing First for Families. It is also being done in other parts of the country. The premise of Housing First for Families is to stay away from the shelter model, that is to try to divert families away from shelters either through prevention or early intervention, and even to divert families from transitional housing. The alternative is to use rapid rehousing and rental subsidies, and these have been shown time and again to help families either exit homelessness early or even prevent them from becoming homeless in the first place. In the state of Washington, there have been some pilot studies of domestic violence, Housing First, funded by the Bill and Melinda Gates Foundation, and these are already showing success in terms of housing retention and consumer improvement in terms of family stability. So I want to talk just a couple of more minutes in the next slide. Just want to mention that youth are sort of the final frontier in a sense in terms of adapting Housing First. Canada is leading the way in this regard. They just began a large-scale national study. They've already adopted Housing First for adults and are now working towards adapting it for the particular needs of youth. That program is called A Safe and Decent Place to Live, and we'll be hearing more from the Canadian Observatory as they pioneer some of these adaptations of Housing First for youth. So in the next slide, and last slide, I just want to summarize by saying that the rise of Housing First has been a paradigm shift. It has really led to decreases in homelessness rather than just managing it. We're hearing this in early reports of the point-in-time counts coming out as we speak. But I also want to point out that Housing First is not housing only, and it is very important, and I think this is where social work is critical, that support services are needed, and they may be tailored to the needs of individuals. Some need less, others need more, but some form of support services are needed. Finally, just to recap, Housing First now refers to differing approaches. All of them often look different, but they should all share in prioritizing access to permanent housing as opposed to shelters and requiring behavioral prerequisites. And I end by saying that much of the impetus for Housing First in some quarters has come from the cost savings argument, but in fact recently a New England Journal of Medicine article and other researchers and policymakers have argued that in the wealthiest country that we live in the world, debates over housing the homeless should be reframed in terms of humane terms and not just in cost-saving terms. So it's been my pleasure to speak about this today, and now I'd like to turn the microphone over to my colleague, Tom Byrne.
Great. Thanks very much, Deborah. I'm going to be talking today about some of the work that has been done through the Department of Veterans Affairs in pursuit of the goal of ending homelessness among veterans, which was set as a policy priority by the Department of Veterans Affairs back in 2009 by then Secretary Eric Shinseki. And sort of where I want to begin my remarks, if we go to the next slide, is really with the Grand Challenge policy brief that Ben mentioned earlier in the presentation. I think this is a really great piece and one that I would encourage everyone to read. And what I like about it is that Ben, Deborah, and our colleague Dennis Culhane did such a nice job of laying out very nicely and simply what is needed to end homelessness. And really they drill down or zero in on two different things. One, addressing upstream factors that cause homelessness, and two, implementing downstream approaches that end or substantially reduce homelessness and its effects. And we can kind of think about this in a public health framework as ranging from primary prevention efforts down to tertiary prevention efforts. So if we go to the next slide, the other thing that the brief did is lay out three guiding principles of what's an ongoing paradigm shift in addressing homelessness, which, as the authors point out, aligns very nicely with social work values, probably not coincidentally, because some of the most influential work in informing this paradigm shift has been done by folks at schools of social work, including folks who are participating in this webinar with me. And the three guiding principles you can see there are prioritizing housing over shelters, valuing client choice and direction, and in echoing some of what Deborah said, matching flexible support services to need, sort of going away from a one-size-fits-all approach. And in thinking about these concepts of upstream and downstream factors and the guiding principles that are laid out in the Grand Challenges policy brief, it occurs to me that this is essentially the blueprint that the VA has used over the past several years to address homelessness among veterans, and it's been used with great success. So thinking about prioritizing housing, one of the things that is an exemplar of VA's embrace of the need to prioritize housing is the HUD-VASH program. So the HUD-VASH program is a program that is intended for folks who are experiencing chronic homelessness. It pairs a deep housing subsidy in the form of a Section 8 voucher with supportive services that are paid for and provided by the VA. And VA first, and one of the things that VA has done is embrace a housing first approach in the HUD-VASH program, making it nationwide policy for the HUD-VASH program. And this shows embrace of the second principle of client choice. So we can go to the next slide. And this is just kind of a graph just plotting the expansion of the HUD-VASH program over time, plotting its growth from 2008 until the present, against the corresponding decline in the point-in-time count of veterans who are homeless. That's a count of veterans who are experiencing homelessness on a given night in the United States. And, of course, correlation doesn't necessarily imply causation, and that's the case here as well. But there are studies showing a relationship between expansion of permanent supportive housing at the community level and declines of chronic homelessness. And HUD-VASH has certainly been a big part of the VA story in driving reductions in veteran homelessness. So we'll go to the next slide. Also in line with prioritizing housing over shelters, VA has implemented and expanded the Supportive Services for Veteran Families program, the SSVF program. So SSVF is a homelessness prevention, reflecting an upstream or primary prevention approach, and rapid rehousing program. So it aims to either help folks at risk of becoming homeless to retain their current housing, or to help folks who become homeless quickly obtain housing stability and regain housing stability. And it provides short-term flexible assistance to veteran households, and it can provide help with things like security deposits, rental assistance, utilities, and so forth. And this is a program that's grown substantially over the past 5 or 6 years. I only plot the growth of the program in that chart through the end of fiscal year 2014, but it has continued to expand since then. We'll go to the next slide, and this is just some preliminary results from a study that looks at the outcomes of veterans who are served by the SSVF program. And so the early results are fairly promising insofar as the majority of folks who received SSVF services did not return to VA homeless services within 1 or 2 years. And of course, this is just results from an observational study, and we need more evidence on this approach to understand just what its impact is and who it's working for. And so we're actually in the midst of trying to secure funding to do a comparative effectiveness study that will use more rigorous methods to assess the impact of SSVF rapid rehousing on housing, health services use, and mortality. And this is something that will have implications outside of the VA as well, just given that HUD's funding priorities have increasingly shifted towards rapid rehousing type approaches to homelessness. We'll go to the next slide. So the last thing that I wanted to mention is one thing that the VA is doing to think upstream and to try and prevent homelessness before it occurs, or to link veterans who are at risk of homelessness or experiencing homelessness but not linked with services to services for which they might be eligible. So since FY 2012, VA has administered a 2-question screening instrument for current housing instability or imminent risk of housing instability to all veterans who access VA outpatient care. So there's upwards of 6 million veterans who've responded to this questionnaire. I'm part of a team that is doing a multi-year study to see how this two-question screening instrument is working and how it is or is not adequately linking veterans to services that can mitigate their risk of homelessness or help veterans who are homeless obtain housing stability. And I think this is kind of an interesting example because it is an instance of a large healthcare system asking folks about an important social determinant of health, and the VA is actually a system where there are resources that can be brought to bear to address housing challenges that folks might be having. I just want to go to the next slide and close with a few important points, which I think are lessons for the Grand Challenge. The first is, and this is kind of echoing what Deborah said in mentioning the piece that was written by Stefan Kertész and his colleagues in the New England Journal of Medicine. The main takeaway here is that housing is an entirely logical and humane response to homelessness. It's just something that logically makes sense and is sort of the right thing to do. And it also doesn't hurt that it has a strong evidence base as being effective for ending homelessness and can, in some cases, make economic sense in terms of generating cost savings. The other lesson from the VA experience, I think, is that adequate resources marshaled towards a single goal can have a really big impact. So it's not just resources that are needed, but resources used in the right way and directed toward housing-led approaches to homelessness. So I think thinking about kind of shifting contexts and national leadership, I think a final lesson is thinking about the need to craft a multifaceted and effective case for why housing-led solutions are an effective response and should be the preferred response for addressing homelessness. I think we need to think about the way in which we craft arguments for solutions that we know are logical and humane responses to the problem of homelessness. So I'll stop there and we'll turn it over to my colleague, Heather Larkin, who will talk about the National Center for Excellence in Homeless Services.
Great, thank you. I appreciate the opportunity to talk a little bit about the background of the National Center for Excellence in Homeless Services and to be able to work together in carrying out the National Homelessness Social Work Initiative in support of the Grand Challenge to End Homelessness. The National Center for Excellence in Homeless Services was launched in 2013. It actually grew out of a long-term partnership between a School of Social Work and a homeless service agency. One of the donors of the Homeless Service Agency, who is not a social worker, recognized the value of partnership between a School of Social Work and a homeless services agency, and the importance of that information flow and the training and research support that social work schools could provide to homeless services. So this donor provided seed funding to start a National Center for Excellence in Homeless Services. And of course, we immediately were focused on not only partnerships between social work schools and homeless service agencies, but recognizing that for this to truly be a National Center for Excellence in Homeless Services, that this would need to be a partnership among social work programs. So we reached out to other social work programs right away to work together in creating this as a consortium where we all focused on strengthening our partnerships with local homeless service agencies in our regions and improving the information flow, not only translating research into practice and supporting providers in our communities, but also learning from innovations on the ground and bringing that into our curriculum so that we could look at creating leadership paths for social work students into the field of homelessness while supporting people who are homeless service providers and leaders in the field, regardless of whether they had a social work degree. So the original partnership was between the University at Albany School of Social Welfare and the Committee on the Shelterless, and then that immediately grew to a national center that included many schools of social work and partnerships with many homeless service agencies and those schools of social work. We're informed by a holistic perspective that includes the housing first model and an appreciation of the accumulated adversity and trauma that many people who are homeless have experienced, and their capacity for resilience and recovery. So this is a center made up of national social work programs in support of homeless service agencies and homeless service leaders, looking to create leadership paths in social work for students going into the field of homelessness and supporting leaders in the field of homelessness with social work knowledge, regardless of whether they are professionally trained social workers. And we emphasize policy partnerships so that we can help to institutionalize effective interventions as we translate research into practice, and also as we're bringing practice to research and building our knowledge. If you could go to the next slide, that would be great. Again, multimodal, holistic perspective. This was also highlighted in the SAMHSA Homelessness Research Resource Center. And the idea is that we're both bringing evidence-based practices to homeless services and then paying attention to emerging and innovative practices, particularly comprehensive approaches that combine housing and supports that we can help to share and disseminate through our programs and across regions. So a perspective that really appreciates cultural relevance, what works in local communities, and social justice, and emphasizes policies to systematize innovations. Next slide. So when we began, we developed these partners across the country, and we set up some leadership symposia in different areas. And in particular, in Northern California, where we had developed a partnership both with the California State University at Long Beach, which had an online program in Northern California, and also with California State University at Sacramento. We set up a leadership symposium near the Committee on the Shelterless, where this all started, and a number of homeless service agency directors who were not trained social workers joined the leadership symposium, and we're very excited about the opportunity to have more partnership and learning opportunities from schools of social work. Out of the leadership symposium, they quickly developed a leadership learning community. And they asked us for a couple of things. One was, at that time, in the fall of 2013, they asked for a paper on Affordable Care Act opportunities for strengthening homeless services. So we created a white paper on that. And then also leadership and training evaluation. So we got some regional funding to carry out a leadership training, which we also evaluated. And so that was something that we shared through a website that we developed as well. The website supported that information sharing and dissemination and innovations exchange. And then out of that website, we were then contacted by the New York Community Trust, where they were interested in doing something to support more homelessness content and initiative in social work. If you could go to the next slide, that would be great. So the National Homelessness Social Work Initiative is actually funded by the New York Community Trust. As I mentioned, they saw what we were starting to do through these national partnerships and with the leadership learning community and what was posted coming out of that. And they wanted to be able to fund a National Homelessness Social Work Initiative. It was something that they were looking to do. And so through that funding from the New York Community Trust, we were then able to expand our partnerships with schools of social work. Really looking at this as an opportunity for a workforce development initiative, where we're building on some of what we've learned in social work around aging and child welfare, and expanding our content and leadership in those areas as well. And then right around the same time that we were receiving this funding from the New York Community Trust to begin the National Homelessness Social Work Initiative, this was when the grand challenges were starting to come out from the American Academy for Social Work and Social Welfare. And then before long, were in 2016 unveiled at the Society for Social Work Research. So we were really poised to be in support of this grand challenge to end homelessness, and again, continue to develop our partnerships throughout the country, looking at ways that we could, as schools of social work, each school of social work, document our baseline activities initially around where we were at with homelessness content and partnerships and information flow and relationship building with local homeless service agencies and also policymakers and field placements. And then look at how we could together through collaborative mutual support approach help each other to take steps to expand our curricular content and knowledge development around homelessness, and to work as a national center to create partnerships with some national policymakers to align around shared goals in addressing homelessness. If you could go to the next slide. So we're now a partnership among 19 schools of social work nationally. Again, all of those schools of social work focusing on increasing field placement opportunities, relationship building with local homeless service agencies, and information flow between homeless services and schools of social work. 6 of those schools are regional hub leaders. And then in New York, there's a liaison model, or in New York, it's actually become a New York, New Jersey regional network. And all of the identified liaisons at schools of social work in New York, and then now in New Jersey as well, have been connected with local HUD field officers for increased coordination. And they've become an example of a networking opportunity for other regions to build on. So as I mentioned, each school has worked to identify baseline homelessness content and partnerships, and then supporting one another and figuring out what are the most logical next steps in building those content and partnerships in each area. And also through the National Homelessness Social Work Initiative, we were able to partner with the Council on Social Work Education. And again, certain activities sort of aligning where Council on Social Work Education was also wanting to do more around addressing homelessness right around the same time that the New York Community Trust had reached out to us, and that the grand challenges were being set forth. So sort of the stars aligning in a way for us to come together and look at as a next phase in social work, how can we expand our content in homelessness? And one of the things that we've talked about is that this is really an opportunity too, with an integrative perspective, to engage more faculty in looking at how their research actually can tie into homelessness, addressing homelessness in one way or another. We recognize that social workers are from many different angles working with high-risk groups. And however you look at those categories, it's the highest risk folks among the different categories that we focus on in our knowledge development and practice that are the ones who are then more vulnerable for homelessness, vulnerable to the societal conditions that contribute to homelessness. So if you could go to the next slide. Here you see our logic model that we put forth in a paper last year for the National Center. And again, I want to mention that the Council on Social Work Education as a partner has been able to support us in doing some panel presentations, hot topic presentations, and creating space for us to have consortium meetings at the Council on Social Work Education, as well as facilitating some of those policy partnerships. If you could go to the next slide. Here you can see all of the schools that are currently involved in the National Homelessness, carrying out together the National Homelessness Social Work Initiative through the National Center for Excellence in Homeless Services. So we've got our partner schools. Again, some of those are regional hub leaders now, and then the New York, New Jersey liaison schools. And so next, I'm happy to turn this over to our research and project lead, Amanda Akanian, a doctoral candidate at the University at Albany School of Social Welfare, who's going to share some examples of partner school activities.
Great. Thank you, Heather. So as Heather said, this next section of the presentation is really going to feature some examples of National Center partner school activities. And I do want to say that most of the examples I'm going to talk about today, along with many others, are also featured on our blog and monthly posts and in CSWE's newsletter. And since the folks on today's call are going to talk about the activities at their own schools, including at USC, NYU, and the University of Maryland, I'm going to focus on highlighting activities at other schools that aren't represented on the webinar right now. And before I get into these examples, I do want to just provide a little information on what it is that we ask of our partner schools and how that connects to the Grand Challenge. So as part of our National Homelessness Social Work Initiative, we ask all of our partners to develop goals for each year that align with the overall objectives of the Homelessness Initiative, the goals of the Grand Challenge, and the needs and the context of each school and in their communities. At the same time, we encourage partners to develop plans that suit the skills and expertise of their school and their involved faculty. And we also encourage schools to expand existing initiatives and build on recent accomplishments, rather than focusing solely on launching new projects. Each year, schools report homelessness-related activities and new developments in a variety of areas, including research and evaluation, curriculum integration, homelessness field placements, innovative partnerships, community awareness, and policy advocacy. And I'm going to go over some examples of each of those starting on the next slide. So many of our faculty from our partner schools are engaged in research and evaluation activities, as you might expect. One recent project is the collaboration of two schools. Emmy Titterington from Rutgers and Dan Herman from Hunter College are leading an evaluation of New York City's Moving On initiative, which aims to move 125 supportive housing residents into independent living, so living without supportive services, using housing choice vouchers and transitional supports. The evaluation is looking at both outcome and process components, and the aim is to identify the individual program and system level barriers and facilitators to successful transitions. The intent here is to use the findings from this large multi-site project to develop best practices for moving on initiatives in New York City, throughout New York State, and across the country. Next slide, Ben. A primary focus of our National Homelessness Social Work Initiative is strengthening the homeless services workforce through innovations in social work education and curriculum integration. As a regional hub leader, Indiana University has focused on developing strategies for assessing homelessness education and how engaged Indiana's social work programs are in ending homelessness. To do this, they developed a survey about homelessness education and awareness that they're administering to BSW and MSW programs across the state. The survey was launched this past spring semester, and while it's largely focused on homelessness within the curriculum and opportunities for field placements and homeless services, it also covers overall awareness of homelessness in their community, community service partnerships with homeless service agencies, homelessness research and evaluation studies in progress, and homelessness and housing-related policy advocacy. The school does plan to use the information gathered from this survey to further develop regional goals and activities and support schools in their region. So the next slide talks about field placements. So in addition to curriculum development, schools have looked for ways to increase opportunities for homeless service internships. And after participating in national center calls with SAMHSA and their SOAR Technical Assistance Center, UT Austin developed a SOAR field placement pilot. SOAR stands for SSI, SSDI, Outreach, Access, and Recovery, and is a program designed specifically to increase access to and successful applications for SSI and SSDI benefits for people experiencing homelessness. SOAR is implemented nationally, and providers receive training and assistance from the SOAR Technical Assistance Center, which is funded by SAMHSA. As part of UT Austin's pilot program, 3 MSW students completed the SOAR training certification and were placed in homeless service agencies where completing applications was a major part of their job. They received guidance and support from the county's SOAR lead, and as of March, the students had submitted a total of 8 applications. Integrating SOAR with field education has 3 primary benefits for schools and students. So first, it provides students with a marketable skill that can benefit them on the job market after they graduate. Second, it allows for more opportunities to provide students with experiences in homeless services. And third, it supports local homeless service agencies by offsetting their staffing hours dedicated to the time-consuming process of completing these applications and can increase their capacity to complete applications successfully. Next slide. The National Center encourages partners to develop and make use of innovative partnerships to address homelessness in their communities. And one way this is done is through collaborations with other schools or departments on their college campuses. So for example, Sandra Fogel, an associate professor from the University of South Florida, partnered with the dean of the school's College of Engineering to recruit a team of students from both schools for the 2016 Hackathon Podapalooza, which was held in Tampa. This was a weekend-long event in which teams were tasked with the challenge of developing apps for the region's homeless population. The team, which is featured on this slide here, developed the idea for an app that would allow homeless individuals to find appropriate shelters in their area. Students learned from the hands-on experience and from each other. So the social work students were able to share experiences and firsthand knowledge about the local homeless population's needs based on having worked with them in their field placements. And the engineering students were able to explain the technological possibilities and limitations of the app. Bringing together social work and engineering students, both coming from fields that address big problems, fostered a shared learning experience, innovation, and creativity in the competition. Next slide. Partnerships with community-based agencies, as Heather mentioned in the beginning, are excellent opportunities for schools of social work to make an impact locally, and many partner schools use them for research and community education. Last November, Binghamton University hosted a screening and panel discussion of the documentary Tiny, The Life of Erin Blackwell, which chronicles the resilience and ongoing trauma endured by a young woman first featured in a documentary about youth homelessness 20 years ago that was called Streetwise. The event was co-hosted with a local homeless coalition, and more than 60 community members and students were in attendance. The panel was moderated by Cassandra Bransford, a professor from Binghamton University who also organized the event. And the panel included a professor from Nazareth College, another partner of the National Center, in addition to the chair of the Homeless Coalition and 2 local providers with expertise in relevant topic areas. Panelists spoke about the experiences and effects of trauma among homeless youth, how to develop effective community partnerships, the implementation of the Housing First model, and what communities can do to end homelessness. Next slide. Other schools have combined their research with community education activities. So for example, last year, Kim Bender and her doctoral student, Jonah DeChance, conducted a photo voice project with homeless youth in the Denver area. The project focused on social issues and concerns relevant to the lives of homeless youth. And while Kim and Jonah have both presented findings from this study itself at both SWR and CSWE, they also held a public gathering with the youth where the youth's photos were displayed and the audience got to hear youth speak about their experiences and their life ambitions. And this was open to the public. Featuring the youth and their work in this way was done to help destigmatize the experience of homelessness. Okay, next slide. So finally, our funder, the New York Community Trust, has a specific interest in policy advocacy activities, which we encourage all schools to engage in. Next slide, Ben. Thanks. This has also been a major focus of the New York, New Jersey Regional Network. The regional network is co-led. I'm sorry, Ben, you can go back to the one. I didn't realize you already switched. This has also been a major focus of the New York, New Jersey Regional Network. This network is co-led by me, Betsy Bowen from the University of Buffalo, and Dan Herman from Hunter College. We developed a policy advocacy subgroup tasked with identifying and coordinating policy advocacy activities at the state and federal level. And this group has researched multiple issues relevant to homelessness and was especially active during New York's budget season, which was the first half of this past semester. In February, we joined the campaign for New York Housing and wrote a letter of support urging the governor to establish the needed agreements to fund 35,000 housing units across the state. Network members also participated in call-in days that were organized by the campaign to vocalize their support numerous times during the budget process. And thanks to years of hard work from the campaign leaders and supporters, this year's budget did include funds needed for the first 6,000 units of supportive housing. Okay, so that's the last example I'm going to go over now. So I'm going to pass this back to Ben to start talking about other schools' activities.
Yeah, thank you, Amanda. It's really helpful to hear. Oh, there's some feedback. I'll try to move forward without that. But it's really helpful to hear about what different universities are doing and how they're creating partnerships to advance the Grand Challenge. Recently, Marilyn Flynn wrote a paper about, thinking about universities as really a way to, as place-based initiatives to address grand challenges. And so it's a powerful model to think of what universities have to offer. And in our case at USC, it's been really great opportunity that the provost of our university has kind of embraced the grand challenge and their version of it, known as the Wicked Problems of addressing homelessness locally. And social work's really playing a leadership role in that way. And so I just wanted to share a little bit about what we're doing and give others on the call a chance to talk about what they're doing or what their universities are doing along those lines. And so, part of this, our university initiative, I'll just kind of run through a few things that's come out of thinking about, what can a university as a whole offer in terms of addressing homelessness. And I think one of the first things we learned is just, how much activity is going on in different areas outside of social work and how important it is to sort of connect and bring those people together. And so, again, this was a lot of work needed just to connect the dots and develop those networks with internal to a university. So we've been working at doing that, and several things have come out of that. And the first thing I'll mention is just our efforts to partner with the county to improve their estimates on homelessness through the homeless count. So that's the first time our university's partnered with the county to do that. We've seen several different practicums develop, so both sort of inter-school and interdisciplinary practicums between policy, law, and social work, looking at decarceration and how that results in homelessness and what can be done about that. So that's students from those different fields who had a shared class and worked on a project together. And also within our School of Social Work, we're doing an enhanced field placement to really let students who are placed in homeless services understand this bigger picture and introduce them to the Grand Challenge and what we're trying to accomplish. More recently, we just developed a center to do research on homelessness locally out of our policy school. So that's something we'll be doing as well. But I also think just getting students more involved. We had a very active homelessness awareness week that was student driven. And as part of that, in terms of advancing policy, there were lots of local initiatives to fund both homeless services and building of permanent supportive housing. And through a lot of sort of, consciousness raising awareness about these issues, Los Angeles actually approved 2 measures to impose a tax specifically to address homelessness. So it's been an exciting year for all of those different initiatives put together and to actually have a measurable impact on how we're addressing homelessness locally. So I'm going to let Deborah talk about what they're working on at NYU currently.
Thanks, Ben. I would like to announce we're very pleased to have a national symposium on solutions to end youth homelessness here at NYU, June 19th and 20th. It is co-sponsored by the McSilver Institute for Poverty Policy and Research and our own School of Social Work, as well as the National Alliance to End Homelessness. We will be featuring some key speakers in the area of best practices for homeless youth, and I would like to invite anyone listening to register and attend this important conference. So that is our primary initiative at this time. Thanks.
Okay, and then Sarah, would you like to share what you guys are doing at Maryland?
Yes, this is Sarah Butts. I'm actually Executive Director of the Grand Challenges for Social Work Initiative broadly, and really wearing my University of Maryland School of Social Work hat to give this update. I also have Dr. Richard Barth, our Dean, and the past President of the Academy on the line, so Dr. Barth, feel free to weigh in. I'd like to just say that University of Maryland School of Social Work is one of 6 regional hubs, thanks to the support of the National Center for Excellence in Homelessness Services, also the University of Albany School of Social Welfare, and funding from the New York Community Trust. This work is really led by Dr. Samuel Little, who is the Dean for Field Education at University of Maryland, and under Dr. Barth's leadership here as Dean. So we have really worked hard to connect those dots and assemble a homelessness council. We have 25 members in 6 partner schools. Partner schools include University of Maryland School of Social Work, Howard University, Coppin State University, Morgan State University, Hood College, and Catholic University. We have both representatives from homeless service agencies in the region, social services. We have a rep from the State House of Delegates. We have faculty, students, someone from the VA, and also reps from all of the professional schools on the University of Maryland campus, dental, nursing, pharmacy, medicine as examples. Our goals are to reduce homelessness, to increase social work leadership and practice, policy, and research, increase housing and support services, and address the upstream factors in collaboration with other grand challenges. Some examples of the work that we've been actively doing recently are really working to increase the number of field placements and also the partner agencies that serve the homeless population. We're exploring an expansion of the task supervisor model to ensure that as we increase learning opportunities and partner agencies, that we have supervision in place to support those placements. We're working to recruit students and also to inspire them to want to focus on work with this population. So we're looking at curriculum and learning opportunities. In terms of dissemination of information, focusing on journal articles about evidence-based interventions, projects for students to become involved, and also in advocacy. And we are planning for engaging all the professional schools on campus and hosting a campus-wide event. Also in participating in the Project Homelessness Connect day here in Baltimore. So that's fine. I was just going to tell you to switch the slide. So we have 3 subcommittees. One is on research, advocacy, and public policy. The other is field education and curriculum development. And the third is on government and interprofessional partnerships. We have pretty well organized. There's chairs of each of these committees. I chair the government and interprofessional partnerships committee. And just recently, we are working closely with the University of Maryland Medical Center on campus. They've actually assembled another working group that's really being driven at the hospital level, where school social work has become very much involved in how can we serve the homeless on our campus and those that panhandle and are likely in need of services. And so a lot of innovative ideas are being generated and discussed at that level, and it's looking like there's a possibility of like an expanded social work field placement unit that may be hosted in the hospital that would provide outreach, referral, and case management to the homeless population here. So, Dean Barth, do you want to add anything? It's looking like there's a possibility of like an expanded social work field placement unit that may be hosted in the hospitals that would provide outreach, referral, and case management to the homeless population here. So, Dean Barth, do you want to add anything?
No, I think you covered it very well, Sarah. Thank you.
Okay, well, thank you all for kind of the updates on what you're all doing. And before we close today, I wanted to give anyone who's on the webinar a chance, if there were questions, comments, or any ideas, by all means, we have a chance now to talk about that. Just to kind of close and direct people back to our website, you can, there it is at the bottom, and you can join our network and get more information as we continue to develop it. So, Michelle, I don't know if you can handle just letting us know if there are people who would like to weigh in or comment.
Yeah, so any of the participants who have questions, your mic should be muted. So if you'd like to jump in, go ahead and unmute your mic on the right side of the screen. It'll say audio off. Go ahead and switch that to audio on. The other option is to just type in the chat box on the right-hand side of the screen.
And so we'll give people a couple minutes, but in the meantime, just if there are more questions about the grant challenges or this webinar series, I think that those questions would be directed to Sarah. And that's
yes,
her
and I'd just like to add, Ben, that the next webinar is focused on creating social responses to a changing environment, and that is May 31st, 1 p.m. Eastern Time and 10 a.m. Pacific Time.
Great, thanks. Okay, so unless, Michelle, you tell me that somebody is asking a question, I think we'll conclude on the hour here. And I just want to thank everyone for joining today and participating.